Hello and welcome to the CRC Covid-19 orientation presentation. My name is Jerry Fallon. I'm the Head of Human Resources for the CRC, and the purpose of this presentation is to ensure that your return to the workplace and your continued presence at the workplace is both safe and productive. As you can see from the content slide, we cover various aspects of the Covid-19 virus, key support roles that the CRC has put in place, and key elements of the CRC Covid-19 guideline document. The delivery of services and how we organise our work has changed dramatically. We all have a responsibility in ensuring that the CRC remains COVID-free in as much as is possible. We need to support each other, cooperate with each other, in order to maintain our own health and safety at work. So this next section deals with how COVID-19 is spread and what some of the common symptoms are. So I'm going to take you through the next 3 or 4 slides and I'll be quiet for them. So here we go. So this is a key slide now. How to prevent the spread of COVID-19. So I'm just going to read these 5 points just briefly. If you have a fever, cough, and difficulty breathing, seek medical care immediately. Wash your hands frequently. Maintain the 2-meter social distancing rule. Avoid touching your eyes, nose, and mouth. Practice and promote good respiratory hygiene and cough etiquette. If you develop symptoms of COVID-19 outside of the workplace, it's important that you contact your GP without delay. Contact your line manager as well. And we're asking you not to come into work. It's important that you stay at home and take care of yourself. If you're in work and you or someone else close to you develops symptoms of COVID-19, the situation should be dealt with in line with the 5 bullet points below. But we would ask you to remember that the situation should be dealt with in a respectful, efficient, and safe manner. And don't forget those key actions in the prevention of the spread of COVID-19. The purpose of the CRC COVID-19 guideline is to provide guidance and support to all individuals to comply with the COVID-19 control measures that the CRC has put in place across all its locations. The next two slides detail those control measures that you are required to comply with. This slide provides good guidance on keeping yourself safe when travelling to and from work. In relation to the last point on this slide, the Bike to Work scheme is a tax efficient way of buying a bike and various accessories and equipment. And if you need more details and you're interested in this, you can contact the HR department. The government continues to advise against non-essential travel overseas. There is a European travel traffic light system now in place, However, you need to understand the implication of this from a work perspective in terms of going abroad and returning to work. These are 4 important points. CRC COVID-19 support structure. As you'll see from this slide, there are 4 support roles that have been put in place by the CRC. Some of these were there before, and some are new. You'll see in this slide that there's a 5th support role put in place, and that's the Infection Prevention Control Advisors. Their role is key in terms of maintaining a safe work environment and preventing the spread of COVID-19 in the CRC. One of the tasks of the lead worker representatives is to complete a weekly checklist. This is what their checklist looks like, just for your information. And here's a list of the lead worker representatives. Within the CRC, the SharePoint site is a central resource for COVID-19 information. Other useful information on COVID-19 and returning to the workplace can be found on HSE Land and HSA. In the main, the CRC uses the public health posters, which are typified by this bright yellow colour. Similar to all buildings across the country, CRC has put a number of control measures in place in order to reduce the spread of COVID-19 in the workplace. The following set of slides detail some of those control measures that have been put in place. Signage and procedures. Reduced seating. Perspex screens. Increased number of hand sanitizer stations. One-way systems. Isolation rooms. Staff have been trained on the use of PPE. PPE storage areas. And we've also taken some preventative measures such as staff working from home, deep cleaning, and reviewing staggering break times and shift times in order to minimise the amount of people travelling around the buildings at any one time. Also, CRC has a clean desk policy in operation, so keep your desk clear so it can be cleaned and sanitised. When you arrive at work, wipe down the area, and when you leave, repeat the process. So what can you do? You can cooperate, comply, discuss and report concerns. As with all aspects of COVID-19, procedures and guidelines are likely to change on an ongoing basis, so it's really important that you keep yourself up to date. CRC has staff working from home and has developed guidelines for working from home, which also includes a home working checklist, which must be completed for everybody working at home. Line managers have exactly the same responsibility to staff working from home as if they were on site. And remember, isolation from work is an issue, so make sure you stay in touch. Minding your mental health continues to be a vital aspect of surviving the pandemic. It's important that you stay informed, but set limits for news and social media. Keep up your healthy routines. Stay connected with others, friends, family, work colleagues. Try to anticipate the stressful situations and support each other. Try to eat well and avoid alcohol and smoking. The CRC operates an employee assistance programme for all employees and family members. Over the last 7 months, the EEP have geared their service to meet with a rise in COVID-19 issues, so they are quite expert in this area now. I want to thank you for listening to this presentation and wish you